Kudroen tonight is the Director General of Department of Health Services, Dr. Ugyen. Doctor, thank you so much for your time. Just to start with, if you could give us some of the significant details about this Move for Health program that we have just had a discussion in our conversation.
This year's Move for Health is in 2002. Actually, Move for Health was initiated by our ex-Lembo Sanging Idup.
Yes.
And he walked from Tashigong to Thimphu, that is 560 kilometers in period of 15 and a half days.
Yes.
And that time he raised, only during the walk, he raised $2 million dollars for the Bhutan Health Trust Fund. And now one is to, this year, one objective is to raise fund for Bhutan Health Trust Fund, one. Another objective is to promote healthy lifestyle among our Bhutanese. And this work will be done, started on 19th October, and it will end on 20 October at Clock Tower, so via Gaselo and Hilila.
Yes.
So, and Chamgang, Simtoka, and then to Clock Tower. So, as I said already, the objective is, one is fundraising, other is promoting healthy lifestyle.
Yes. Yes. Now, how are people going to contribute? The ways to contribute, if you could elaborate a bit on this so that people know how to contribute.
So, on contribution, so first within Bhutan, so we have already sent our brochures and information to all the potential donors, people who have money.
Yes.
Also information to all the people in Bhutan. If anybody is willing to contribute, even 1 ngultram will help Bhutan Health Trust Fund a lot. And this contribution will start from Pajo town, where Move for Health work will be starting. We flag off from there.
Yes.
And then we will be carrying this money received from Bhutan Health Trust Fund, and on the way also, if anybody is donating, we will receive the donation and then issue them the receipt on the spot. And all whoever donates will be entered in our website, so that anybody can view it with their name and amount of contribution. And once we reach Thimphu, we will be in Clock Tower, so anybody can come there and donate. And our Health Trust Fund officials will be there to receive and issue receipts.
Yes.
So now this is contribution mainly from within Bhutan. So it is not limited to those 2 days, but anybody can contribute to Bhutan Health Trust Fund anytime. Our Health Trust Fund account number, whether the dollar account number and ngultram account number, is given in our website.
Yes.
And also we will be propagating this web account numbers and the process of donating through our media, so Bhutan Television, BBS radio, and other private radios, and also print media will be propagating this information. The one important aim during this work is now, because in Bhutan non-communicable disease are increasing every year, like diabetes, hypertension, cancers, and alcohol-related disease. These are increasing every year, and the expense to the government to treat these cases are enormous.
Yes.
So, just to give an example, to treat a diarrheal disease patient coming to hospital as a OPD, it will cost to the government around 400 ngultrams. But to treat a heart disease patient or a diabetes patient as a OPD case, it will cost the government 7,000 to 8,000 miltram. So that's why we want to promote healthy lifestyle, so that our people will prevent themselves getting this diabetes, hypertension, heart disease and all this.
Yes, so, Doctor, just to continue from what you just said, now you're talking about the increasing number of more and more patients who are suffering from non-communicable diseases, lifestyle-related diseases, and also our population is growing. But on the other hand, you're also suffering some budget cuts for procuring medical facilities and other amenities for health services. So how serious are you about providing free healthcare services for our people as enshrined in the Constitution? This must be a serious cause of concern.
Yes, Bhutanese people are very lucky. We have our visionary kings, and kings have given us free medical service to all the Bhutanese population. And we in the health ministry, we officers, we are there to utilize whatever fund budget given to us, utilize it effectively to purchase essential medicines and medical equipments and consumables and other health products which we need to run our health facilities. But we in the health ministry are also concerned about the decreasing availability of budget to the health ministry over the years. Yes. In the initial periods or plan period, health ministry has been getting 7 or 8% of GDP to health. Yes. But now we have studied in the health ministry, we have found that with progress of this plan periods, so from 9th plan onwards, health has been receiving less of the GDP to health. Yes. So in the 10th plan, in fact, health got only 3.4% of GDP. And this is I think all Bhutanese should worry, because if such decrease occurs, then ultimately the population, health service to the population will suffer. Now, yes, of course, in the health ministry we need to improve the efficiencies, cost effectiveness. We have to be mindful of this, and wasting of money and all this we need to be concerned, always keep in mind all those. But at the same time we need to receive adequate budget. So every year Ministry of Health plans various activities, and during the budget discussion, so important trainings for health workers, the budget for purchase of medicines and equipments, these are cut. And then during the process of procurement, yes, sometimes it's a big challenge for us. Yes. Because health facilities we can't keep without medicine, laboratory reagents and gloves and cotton and all these things in order to provide good service to the population. So if the money is not available, then these shortages can occur, and ultimately our population can suffer. So this is and another is the public health activities, that is in disease prevention and health promotion. Most of the budget just now public health department gets is from international organizations like WHO, UNICEF, yes, and UNFPA. So there is very little percentage. I think only pay and allowances are from Royal Government of Bhutan, but remaining program activities are all from outside. So there we need to strengthen. We need to, Bhutan needs to do lot of activities on promoting healthy lifestyle to yes, our population, and that is the most cost effective. If we can strengthen the activities of Department of Public Health, then many of our people who are today coming to hospital, in future this number can decrease.
Yes.
And then we can still continue with sustainability of free health care. But if we don't strengthen the activities of public health department, then the number of kidney failure patient or diabetes patient will increase every year, and it will cost the government enormously. And then we might have to deprive money to diarrheal disease and ARI and divert to treatment of kidney failure and kidney transplant and all this. So it's a concern. Overall, health ministry requires at least 5 to 6% of GDP allocated to health ministry.
Yes, sir. Doctor, as a head of the Department of Health Services, are you just presenting this as a hypothetical situation, or do you foresee this happening?
It's not hypothetical now, because I am in Department of Medical Service. So I am every day involved in maintaining the dialysis machine or purchase of dialysis machine, dialysis fluid, and then in order. So there are so many related activities, and in the treatment of cancer, referral of patient outside Bhutan. So all these are increasing every year, and on the referral of patient outside the country, government is giving us about 8 to 10 crores every year. But last year it has shot up on top of approved budget. We had to request for another 5 crore more. See, so this is the reality. And the treatment we give to dialysis patient or money spending on kidney transplant is anybody can see. Some kidney transplant patients, it costs 22 million. Yes. While some patients we can manage within 6 to 8 lakhs. But some complicated cases we have to spend 22 million. So it costs the government enormous. So that's why it is my request to the people of Bhutan is to listen to the health messages on physical activity, balanced diet, non-abuse tobacco and alcohol. These 3 simple things, if everybody practice, then all these cases number will go down. And then we will have limited patients of kidney failure or NCD patients, and we can manage effectively.
Yes, sir. Now these are some of the serious causes of concerns that Doctor just raised. On top of that, another concern would be procurement has always been an area that has always been vulnerable to corruption. So as a head, are you going to put stringent measures so that no corrupt practices are there, so that funds are not getting siphoned by individuals, whereby the loss is ultimately to be borne by the public?
So in the procurement, one issue is individuals will not take away the government fund and put in their own account. That is one issue. Another is procurement efficiency.
Yes.
So there is lot of wastage, lot of purchase of unwanted things. So we need to decrease this. So one is efficiency. So regarding thanks to ACC and Royal Audit Authority, they have advised Health Ministry 2-3 years ago how to improve the system, and from the time they have advised us, so we have streamlined the procurement system. So before we have a division called Drug, Vaccine and Equipment Procurement Division.
Yes.
So that procurement division receives all the indent from all the health facilities. They quantify how much to buy, they buy, and then they distribute. So yes. There is some conflict of interest, because they can change the quantity they buy, whether yes. Quantity of medicine or quantity of equipment, expensive equipment. They can increase the number as they like. Yes. So now with the advice of ACC and Royal Audit Authority, now this quantification or book of quantity, that is now established under in my department, in the ministry. So we have a separate unit which will receive indent from all the health facilities. Then we compile and then we cross-check with the health facility. Do you really need this much? Or do you really need this equipment? We cross-check with them. After they agree, then we make the overall how much drugs to be procured, what type of equipment and how much to be procured, and that after that only we send to DVD and please tender out and procure this, and then later on we send them the distribution list for the health facilities. So DVD is now only specialized in procuring and distributing. Remaining part of the work is all done in the health ministry. So their conflict of interest is now because they cannot change any quantity unless they get approval from the ministry to change. So if health facilities require more, then the ministry will again ask DVD, this drug, last time we procured only this much amount, but we need to procure more quantity. So unless they receive this, they can't procure more. That is one. Now in the DVD, in the procurement system, so we have different committees. One tender opening committee. Then after that, once it is open, then evaluation committee. These are basically composed of technical people, specialized in medicine and drugs, or specialize in equipment, their own field. So there is evaluation committee, and then there is tender selection committee. So all members are different, so each cannot influence the other, and another all have to sign the conflict of interest form during all the procedures. So now DVD is transparent. We show all these processes to our drug suppliers also, so they cannot also influence the people, committee members. So we are now more transparent and efficiency is improved because book of quantity is established in the health ministry. So we ask a lot of questions. If they ask the equipment, why do you need this? For what purpose? So all these are verified. Then only the real needy or prioritized equipments are put for purchase. So we have improved.
So doctor, with all these measures put in place, you assure the people of Bhutan that there will be no trace of corruption in procurement business in health. This must be quite a big challenge.
Yes. This is still a big challenge. Procurement division is still a vulnerable area because you have to interact with with the suppliers. You have to really closely interact. And if you really closely interact and get emotionally involved, then again likely chance of corruption. That it is, the risk is still there. But we have minimized the risk on the recommendation of ACC and Royal Audit Authority. We have minimized compared to before. Now it is really minimized, but we have to be vigilant all the time, and we need regular auditing of this, the periodical auditing of this division is really essential in order to see if there are any corrupt practices.
Yes, sir. I think moving a little away from what we have just discussed, what about the health center that you have? Are people making best use of it?
HHC or Health Help Center in telephone number is 112.
Yes.
Personally, as I see, of the all health services which health ministry provides, of all the services, this is the fairest of all the services, very fair. Anybody can dial 112 if they are in need. If there is a sick patient in the house, if they are involved in an accident, or if there is a disaster, they can call 112. And then you have the person has to explain what problem they have. So if there is need for ambulance, 112 will send ambulance and give advice to the patient or the party where the ambulance will be, and they will be informed. So service is very fair. And
you don't have to throw your weight around.
No.
I'm this minister, that so this Limpo.
So now for ambulance, any person in Bhutan need not call the Ministry of Health or the hospital authority. They should call only 112.
Yes.
And all you have to do is identify your name and which village or which road or which building you are in. So accordingly, ambulance will reach. So but the sad part is, not all 20 Dzongkhaks are utilizing this 112 equally.
Yes.
Only few Dzongkhaks like Thimphu, Paro, Punakha, Chukha, they are utilizing this 112 facility and requesting ambulance reasonably okay.
Yes.
But some Dzongkhaks are still not calling 112 for help, because it is not only ambulance service. It gives, one is ambulance service, another is health advice. Sometimes in the panicky situation, you don't have to rush to hospital.
Yes.
They help people in the 112 help center computers. They can advise the people what to do and how to manage their patient, and at slower pace next day they can go to hospital. They don't have to rush. So health advice and ambulance are the two.
Staffing pattern, you have a doctor?
During daytime there is doctor. But at night only the health workers who are trained to answer 112 are there. But most of the queries which people have are already there in the computer. So any questions people have, any doubt people have, they can ask the health worker and they will look up in the computer and give prompt reply.
Yes.
So there's 24-hour service is there in 112.
But there are people who are abusing this.
Yes. My main concern is in last 1 year there is 4,49,000 calls to 112. But out of that, only 49,000 are genuine calls. 4 lakh calls are all hoax calls. People are misusing, misusing 112. So, misusing in many ways. Some, they ask for ambulance. When we send the ambulance to the place they have requested, and then they don't come to ambulance. And when we ask them, ambulance is waiting for you 15 minutes, where are you? Then they tell they are not in Thimphu, they are in Tashigong or Samduzongka. So like these abusers, there are abusers who abuse our health workers who are working in 112. Another is people who just make fun of our 112. And another is who tell lies, people. So there are various kind of callers. So this is sad. Out of 4,49,000, 4 lakh calls are false or not true calls. They just want to waste the time of 112. And if such trend continues, it might decrease the opportunity for real genuine callers to get ambulance in time or medical advice in time. So my request to the Bhutanese is, please don't misuse 112. If you are in need, call 112 and you will get the service.
So, apart from your request, can you practically do something on this? Maybe trace the number and hand it over to police, so that some sort of disciplinary actions are required to tame the Bhutanese.
Yes. Actually, our 112 or HHC software can capture all this. The telephone number they can trace, the voice will be recorded. We have evidence.
Yes.
But and also we have educated the Bhutanese population through our Bhutan television and radios that please don't misuse 112. If you misuse, we can take you to court also. We have the capability. But if we are forced to the corner, we might have to take this hoax callers to court also.
Because going by the number is a
huge number, yes. So still I would like to request, before we take any stern action, please don't misuse 112.
So, final question, Doctor. Now, despite all these challenges, health system, as people believe, is doing very well. Now, I'm sure you must be getting lots of pressure on privatization of health services. What do you think? Is it a good option?
First, I think privatization pressure, both from business community and from health workers, starting from doctor to nurse to at all levels, pressure for privatization is very strong, getting stronger in fact every day. But internationally, maybe our own Bhutanese might say our health system is not good. But globally, I work in the Ministry of Health. I feel very proud. Internationally, Bhutan is appreciated for our good health system, and which is free, fair and equitably distributed in 20 districts. And this is appreciated globally. So that is one. Another is Bhutan has a good essential drug program. That drug, in the essential drug list, we have about 367 essential drugs. And these 367 drugs can manage about 95% of the diseases prevalent in Bhutan with this drug. So globally we are appreciated for this primary health care and good referral system.
So you won't recommend privatization?
Our kings have given to Bhutanese population free health care. Now if we start privatizing, then this good health public system which is there, it will get destroyed some way or the other. That is internal brain drain. But privatization does not lead to one thing, improving in quality of service. This is internationally proved. It does not lead to. It is only assumed it will improve quality of service. Assumption only. Personally, I would not recommend too much privatization of healthcare service, because large majority of Bhutanese population, and keeping the vision of our kings to provide free, fair, equitable health service to all the population, I think we should preserve the present health system.
Thank you so much, Dr. Ugyen Dophu. Well, this brings us to the end of Kudroen. Thank you so much for watching. Tashidalil.